The Affordable Care Act is obviously the most important piece of health legislation that has been passed in the United States since the Medicare and Medicaid programs were enacted in 1965. And as everyone in this audience already understands, the law is perhaps the most polarizing and controversial piece of legislation of our generation. It serves as a lightning rod for criticism of President Obama's entire presidency and continues to mobilize conservatives who remain committed to repeal and replace it with, well, we're still waiting to see what the Republican plan is going to be. Although, to be fair, 4 Republican senators recently released a plan that would first repeal Obamacare and then immediately restore most of its major components. And that's honestly not a joke. If you look at that plan, that's exactly what it would do. But my goal today is to shed some light on the persistent controversy surrounding this law by first reviewing the broader historical context of efforts to extend health insurance to all Americans, and then by presenting more recent evidence to answer the question, is 2014 finally the turning point? So, let me very quickly review the long and often torturous road towards universal access to health care in the United States, a story that began more than a century ago. Briefly, prior to 1929, there was no health insurance as we think of it today in the U.S. And in fact, the first health insurance of any sort was actually workers' compensation. The nation's first state Workers' Compensation Act, guaranteeing coverage of medical expenses for work-related injuries, was enacted in 1911 by the Wisconsin legislature and became effective on September 1st of that same year. The constitutionality of the act was upheld by the Wisconsin Supreme Court on November 1st, 1911, and by the U.S. Supreme Court in 1926. So, lesson number 1 from history: social change does not occur without significant legal challenges. Organized labor, whose efforts led to rapid proliferation of workers' compensation laws in 36 states by 1920, attempted to build on this success by developing model legislation to extend general health insurance benefits to workers. These efforts, however, were met with much greater resistance, and as a result languished until the election of FDR in 1932. FDR campaigned in 1932 promising a New Deal to Americans to address the economic collapse and the Great Depression that had been triggered by the stock market crash of 1929. But in 1935, as FDR moved forward with his proposal for Social Security, he backed away from supporting national health insurance. Roosevelt feared that his proposals for a national pension system and for unemployment insurance would be jeopardized if promoted along with a national health insurance program. Now, FDR's fear was not unfounded, because the head of the AMA, Morris Fishbein, had editorialized during this same period against recommendations for voluntary prepaid health insurance based on the Kaiser Permanente model, what we now call HMOs. In 1932, the Committee on the Cost of Medical Care had recommended the growth of private voluntary prepaid health insurance instead of a national health insurance program to deal with the pervasive lack of health insurance among Americans. But Fishbein claimed that prepaid health care represented the interest of, quote, the great foundations, public health officialdom, social theory, even communism and socialism, inciting towards revolution. Now, these criticisms sound like they could have come from any recent broadcast on the Fox network about the evils of Obamacare. So lesson number 2 from history: tread lightly when challenging powerful stakeholders. It wasn't until 1965, more than 50 years later, after the initial efforts to pass health insurance laws at the state level, that the U.S. finally took the first step towards compulsory health insurance, focusing on what was then widely recognized as the most vulnerable and deserving portion of the population, the elderly. This was the largest population left out of the employment-based system that had grown rapidly during and after World War II. And although a private insurance market did emerge for seniors in the 1950s, who generally lost their health insurance benefits when they retired, only about 50% of the elderly purchased private health insurance, primarily because more than 30% lived below the federal poverty level and thus could not afford insurance. It's also worth noting that Isidore Falk and Wilbur Cohen, who originally developed the concept of Medicare as early as 1951, viewed the law as the first step towards national health insurance for all. Medicare was signed into law by LBJ on July 30, 1965, and 1 year later, more than 19 million seniors began receiving benefits. Medicaid was also signed into law the same day and focused on low-income individuals who were either 1, children without parental support, 2, the caregivers of their caregiver relatives, 3, elderly, 4, blind, or 5, individuals with disabilities. In its first year, Medicaid enrollment was just short of 5 million, but within 5 years, enrollment exceeded 16 million Americans. Lesson number 3 from history. Incremental efforts targeting those who fall through the cracks of employer-sponsored health insurance are politically more feasible than fundamental reform, especially if that population is widely viewed as deserving. So fast forward another 45 years, and the U.S. finally took its second major step towards providing universal access to health insurance when President Obama signed the Patient Protection and Affordable Care Act in 2010, also known as the ACA. Opponents of the law are quick to label it pejoratively as Obamacare. In fact, there is a now classic video segment from the Jimmy Kimmel Show interviewing people about the ACA and Obamacare. People generally like the ACA, they hate Obamacare. Lesson number 4 from history. America remains fundamentally divided over social programs that provide assistance to low and middle income families. Now, given this glacial movement towards national health insurance in the U.S., one can only speculate as to when we as a nation will finally reach the goal of universal access. But if I were to simply extrapolate from the pace of progress over the last 100 years, I think it's safe to say that it's most likely to be another generation before we see a Health Care for All Act that finally closes all the remaining gaps in the U.S. system of health insurance. So, in 2009, when the ACA and other health reform bills were being drafted, Americans could be sorted into 4 categories of insurance that are shown in this slide. And just remember that these categories are not always mutually exclusive. First, employer-sponsored insurance covered the majority of Americans. But only 2 states, Hawaii and Massachusetts, required employers to offer health insurance to their employees. And because insurance was regulated solely at the state level, standards varied considerably across the country. Second, Medicare provided nearly universal coverage for seniors and those with disabilities. As a federal program, Medicare provides relatively uniform benefits, although changes over the last 2 decades have allowed greater regional variation in those benefits. Third, Medicaid did not cover everyone who was poor. As mentioned previously, it covered poor children and their caregivers primarily. But being just poor did not make one eligible for Medicaid. And because Medicaid is a federally supported program administered by the individual states, eligibility standards varied substantially across the country. Finally, for everyone who failed to qualify for these other forms of insurance, there were two options. One was to buy insurance on your own in the individual non-group market, where most states allowed insurers to deny coverage or to charge substantially higher premiums based on your health status. The other was to go without insurance and either to pay out of pocket or to depend on charity care. And as conservatives are fond of pointing out, because of a federal law known as EMTALA, no one can be legally denied emergency medical care because of inability to pay in the United States since 1986. As a result, they are often fond of saying that no one in America is really uninsured, which, if you think about it, is really quite an astounding statement. So prior to the ACA, the lack of an employer mandate to provide health insurance meant that the likelihood of offering health insurance varied by company size. While virtually all large employers offer health insurance to employees and their dependents, small firms have historically been much less likely to offer health insurance benefits. As a result, employees in smaller firms have been more likely to remain uninsured due to a lack of job-based coverage. So given the patchwork of private and public insurance in the U.S., who are the uninsured? As shown here, the uninsured totaled almost 48 million as of 2011. 90% of the 48 million have incomes below 400% of the federal poverty level, which 400% now is about $46,000 for an individual, or $92,000 for a family of four. And the vast majority of the uninsured are adults, both with and without dependent children. Those without dependent children were not eligible for Medicaid at all. And those with children were not eligible in many states because of the extremely low income eligibility thresholds in those states. For example, in Texas, parents with Medicaid eligible children are themselves eligible only up to 19% of the federal poverty level. So because too many Americans fell through the coverage gaps prior to the enactment of the ACA, there are three basic principles that influence the structure of the law. Now, of course, the federal law was also influenced by a similar law that was passed in Massachusetts in 2006, with bipartisan support by a Republican governor who later ran for president and denied that he had sponsored that law, or explained it away, and a Democratic legislature. That law opened the door at the national level for a similar approach to health care reform. So the three basic principles of the ACA are: first, to expand access to private insurance and Medicaid rather than to enact fundamental reform. As a result, despite claims to the contrary by conservatives, this law is incremental reform. Second, to provide federal funding to subsidize the purchase of private insurance and to expand Medicaid, while allowing significant state variation in implementation. This strategic decision to employ what is now known as, or is known as new federalism in structuring the law, was an attempt to diminish conservative opposition and to enhance acceptance of the law at the state level. Ironically, this strategy has had just the opposite effect and has created opportunities for opponents to engage in non-compliance at multiple levels, as I'll discuss further in a moment. Third, to expand private non-group and small group insurance markets subject to extensive new federal regulations for the first time. The insurance industry accepted these new regulations as a quid pro quo for the new federal subsidies, allowing the previously uninsured to buy insurance in the newly established marketplaces that are known as exchanges. So turning to the specific components of the ACA that are going into effect this year, these are based on the principles that I've just presented in the previous slide and the model provided by the Massachusetts Health Reform Law. First, the law this year has established mandates for individuals to have insurance or pay tax penalties for remaining uninsured, and mandates that medium and large employers offer insurance to their full-time employees or pay new taxes. Now, these provisions have been delayed for firms, but they will be going into effect next year. The individual mandate was the primary basis for the constitutional challenge to the ACA and was upheld by the Supreme Court in June of 2012. However, and I can't stress this enough, this feature of the law continues to be the single most unpopular feature of the ACA among opponents and supporters of the law. Almost no one likes the individual mandate. And of course, the irony here is that the president himself originally did not support the individual mandate. During the campaign of 2008, Hillary Clinton supported the individual mandate. Barack Obama did not. Second, the law provides subsidies for those with incomes between 100 and 400% of the federal poverty level who are otherwise not eligible for Medicaid. This aspect of the law requires individuals to pay between 2% and 9.5% of their income in premiums on a sliding scale that increases with income. The subsidy is then calculated as the difference between this required payment on the part of individuals and the premium of the second lowest cost silver plan in their local marketplace. Third, the law expands Medicaid eligibility for those with incomes below 139% of the federal poverty level and provides full federal funding to states for the first 3 years of the expansion, eventually dropping to 90% federal support by 2020. Now, it's this last provision of the law that was found unconstitutional by the Supreme Court because it required states to expand their Medicaid programs or lose their entire Medicaid funding. The court found that this was excessively punitive, and as a result, the Medicaid expansion is now voluntary, which has opened up a whole new line of attack by opponents of the law, as I'll show in the next slide. So currently, 26 states and the District of Columbia, indicated in light blue on this map, are moving forward with Medicaid expansion. The 19 states shown in red have decided not to expand their programs, and the 6 other states shown in yellow are listed as in debate over expansion. Although closer examination of the so-called debate in these states reveals strident attempts to transform Medicaid by calling for, among other things, drug testing and proof of job search as conditions for Medicaid eligibility among the newly eligible adults. Now, rest assured that these efforts are not going to be approved by the federal government, but nevertheless, these states are exploiting this opportunity to demand concessions from the federal government in exchange for their willingness to even possibly considering expanding access to the poor. The failure of the states in red and yellow on this map to expand their Medicaid programs means that 4.8 million Americans will remain uninsured unnecessarily this year and into the indefinite future. not to mention the billions of dollars in federal support for expansion that will be lost. But what about the progress in the new marketplaces and in those states that are expanding their programs? This is not all bad news. The good news is that as of the beginning of March, roughly 4.2 million nationally have signed up for insurance through the new marketplaces, including 83%, or 3.6 million, with subsidies. Another 4.4 million nationally have been confirmed as eligible for Medicaid. And the news in California is even better. California leads the nation in both marketplace enrollment and Medi-Cal determinations. In addition, California transitioned about 652,000 individuals into Medi-Cal without going through Covered California. These individuals were previously enrolled in county-based programs, such as Healthy Way LA, and became newly eligible for Medi-Cal on January 1st without having to go through a new enrollment process. So a fundamental question is, how many of these individuals were previously uninsured? And although we don't know precisely, and we won't know precisely the number until later this year, based on work that we've been conducting for Covered California at the Center for Health Policy Research, we expect that about 75% of those who are newly enrolled in Medi-Cal and about 57% of those newly enrolled in Covered California plans with subsidies will have been previously uninsured. So if our estimates are correct, California may have 1.3 million fewer uninsured residents in 2014 compared to 2013. An astounding first-year success for the ACA. Now, if you add to that total the 652,000 people who transitioned into Medi-Cal from the county programs, these individuals are now enrolled in Medi-Cal, and the programs that they were in last year were not truly insurance, they were coverage. If we add that to the total, there are close to 2 million Californians this year who will be newly insured. And I think that that number is truly amazing. But the good news in California remains tempered by the longer-term projections. And frankly, the ACA was never expected to lead to 100% health insurance coverage in the U.S. First of all, the undocumented are not eligible for benefits, and they represent about 7 to 8 million of the currently uninsured nationally, or roughly 3% of the non-elderly population. Second, despite the availability of subsidies and the mandate to have health insurance or pay a tax penalty, many individuals and families will still find premiums unaffordable and thus remain uninsured despite the tax consequences. Finally, despite the expansion of Medicaid for low-income individuals in half the states, we know that many individuals will forego those benefits for reasons that are complex but well documented in numerous studies of the eligible but not enrolled Medicaid population. So, if the law has already enrolled millions of Americans in more affordable health insurance, many for the first time, why does this law remain so controversial? And can we expect the extreme divide we face as a nation regarding this law to begin to subside this year? I mean, after all, the major benefits of the ACA are finally going into effect. Finally, after almost 4 years since the law was signed. So, is 2014 finally the turning point where we begin to bridge the enormous political divide over Obamacare? Well, unfortunately, the public opinion polling doesn't seem to suggest that we've turned the corner yet. In fact, the latest polling figures from the Kaiser Family Foundation suggest just the opposite. although some of this appears to be the result of the flawed rollout of the government's healthcare.gov website and the intense media coverage surrounding those problems. But the fact that the yellow line is going up and the green line is going down is not good news. But I've tried to present the ACA today in its long-term historical context. So let me suggest that the fight over Obamacare is likely never to be fully over. But that's not necessarily bad news. There's plenty of historical evidence to support my hypothesis. First, here are just two of the hundreds of quotes I could have shared regarding Social Security, which now, almost 80 years after enactment, is still under attack by political and fiscal conservatives. Although Rick Perry's extreme condemnation of Social Security is not shared by most conservatives, there are nevertheless ongoing efforts to dismantle Social Security as a government-administered pension system and to replace it with a mandatory private pension system. Similarly, the fight over Medicare still continues nearly 50 years after its enactment. More than 50 years ago, then General Electric spokesman Ronald Reagan warned the nation of the threat of socialized medicine, represented by the earliest proposals for Medicare that had been introduced into Congress as early as 1957. And by the way, the LP, for those of you Gen Xers out there, is a long player. That's what we call vinyl. That was a vinyl record. Meanwhile, during the last presidential election, Representative Paul Ryan became the latest in a long line of politicians to call for Medicare reform that is less about repeal than privatization, namely how to limit government liability by transforming the program into a private voucher system, otherwise known as a defined contribution system. Such reform would fundamentally change Medicare. Now, while Representative Ryan and other conservatives are ready to move full speed ahead with dismantling Medicare and relying on the market to keep premiums affordable, they are at the same time adamantly opposed to ACA, which creates similar private markets with vouchers for the uninsured and those in the non-group market. But this actually makes sense if your only decision rules on social policy are, first, oppose all social spending. Second, repeal all existing social spending. Third, if repeal is impossible, transform social programs from direct government provision to government funding of private markets. As somebody who believes in evidence-based policy analysis, there is evidence that 2014 will be a turning point and that we will recognize it sooner rather than later. Even among those with overall unfavorable views of the law, 31% of them agree that the law should be accepted and that Congress should work to improve it rather than repeal it. Furthermore, 55% of all respondents in the recent Kaiser Family Foundation survey agree that efforts to repeal the law should be abandoned and Congress should work to improve it. Furthermore, 11 years ago, Congress enacted the Medicare Part D benefit, which created a regulated marketplace for prescription drug policies and subsidies for Medicare beneficiaries to shop among competing plans in the area. As shown in these polling results, the Part D program was extremely unpopular immediately after it was enacted by Congress in 2003. And while those negative impressions diminished between the enactment of the law and the implementation of the law, negative opinions spiked again in late 2005 and early 2006 as the first open enrollment season was ramping up and was underway. Although the Kaiser Family Foundation stopped tracking this issue between 2007 and 2012, look at where things stand at the end of 2013. Almost 2/3 of beneficiaries now view Part D favorably versus only 14% negatively. This is an astounding turnaround. This graph is the best evidence I can present to you today that this year will be the turning point for the ACA. Now, the only caveat I have is that in 2006, the Tea Party, the Fox Network, and the Koch brother financed Americans for Prosperity were not working together to repeal Part D. Those forces did not align against Part D. And 2014 is a midterm election year where anti-Obamacare sentiment will be prominently featured in attack ads intended to mobilize the conservative base. So to bring my comments to a close, President Kennedy proclaimed in his inauguration address 53 years ago that the torch has been passed to a new generation. And he closed his speech by challenging my generation to ask not what your country can do for you, but what you can do for your country. 2 years later, Dr. Martin Luther King proclaimed in his address to 250,000 participants in the March on Washington that he had a dream of an America where his children would one day be judged, not by the color of their skin, but by the content of their character. So here is my challenge and my dream for the next generation of public health professionals, including many of you in the room, our graduates and future graduates, who are inheriting this century-old battle for universal health care. My challenge is for you to keep your focus on the ultimate goal. This is not a battle that's going to be over in 2014. And if history is a guide, you may spend your entire career before we as a nation see the next and hopefully final step towards universal access. But the fight is worth every minute, and we are counting on you. And my dream is that one day my grandchildren will live in a country that provides quality health care to all Americans, regardless of their income. Thank you very much.